One of the features of the centre that I'm particularly excited about, and indeed I really look forward to working closely with, and that is the fact that we've placed a very significant emphasis on training and developing our workforce so that they are equipped to understand new and emerging approaches to healthcare. We see this as a really significant opportunity, and I'm really delighted that we've been able to support a number of initiatives where we're able to draw upon the expertise that sits within our partnership and ensure that we can convey that to the next generation.
The Centre for Translational Medicine is ambitious in its aims to address the major health burdens for local, national and global communities, and to challenge existing health inequalities. To do this effectively, we need to engage and involve our patients and the public in all our decision making. These successful applications clearly demonstrated a commitment to health equity. The breadth and diversity of these applications has been excellent, and our ambition is that this research will help improve outcomes for patients and bring research to life for our patients and community.
The Centre for Translational Medicine funding was to fund the King Centre for Lung Health. Of course, many of us don't notice when we're breathing, fortunately, but there are some of us who really notice when we're walking up some stairs or walking on the flat, that breathlessness and symptoms of lung problems and lung ill health are manifest. We have a very diverse community locally here in the KHP community. And so we really understand that it's important to encourage and be as diverse as possible with our questions, with our patient recruitment, and of course making sure that patients are along with us at every step of the way.
King's Health Partners is uniquely placed to deliver the agenda for the modern healthcare. That means bridging the gaps in health inequality, and at the same time bringing in newer treatments, neurodiagnostics for better health. Our partners are placed in a relatively deprived population that gives an opportunity to bring in new treatments, new diagnostics. At the same time, we have big basic science labs to support all this with artificial intelligence, so that puts us in the forefront of delivering the best healthcare in the world.
I work with a huge volume of health data about patients and our populations in South East London. This involves Guy's and St Thomas's Hospital, King's College Hospital, and South London and Maudsley Hospitals. The funding from the Centre for Translational Medicine will galvanize our ability to standardize the data. Although we have a very large amount of data, in the order of billions of documents and letters, most of this data is not standardized, and therefore we would have to rely on researchers to manually read each page. This is not feasible in the long term, and obviously new data is being generated every day. The additional funding we will use to standardize the data into a common format so that it's comparable between research studies.
So we're sitting here in the clinical research facility at Guy's and St Thomas's. So this is infrastructure that's funded by NIHR to support experimental medicine across the trust, and it's used by all sorts of disciplines. My particular interest is cancer, and we use this space to do phase 1 trials in that disease. The Centre for Translational Medicine has generously supported us in staffing our work here by funding a senior clinical fellow. So this is an experienced clinician with a lot of oncology under their belt who is seeking to train in the delivery of clinical trials like the ones that we administer here.
Through my experience, I realized that through the energy and commitment and faith of professional scientists in the work that they're doing, by far trumps the suspicions that others may have about whether their work is worthwhile or not. For me, science, the work and the science with this, in my particular instance, has changed my life.
So I've just finished my PhD, and that's been looking at ways of using AI or artificial intelligence to improve the detection rates of congenital heart disease in unborn babies. And this fellowship is actually going to pay for half of my salary for the next 2 years, which allows me to continue with that research work while spending the other half of my time doing clinical work here in the hospital. Different parts of the country have very different detection rates. So using artificial intelligence, there might be a way of reducing that inequality. So the areas that are really struggling to detect congenital heart disease, we could use newer technology and modern technology to try and improve that and try and level up the worst performing areas.
I'm very lucky and very happy to have got this funding from the Centre of Translational Medicine for a post on NIRS imaging technology. So NIRS stands for Near Infrared Spectroscopy. It's an imaging technology which is particularly suited for little children. The aim of the Piers Morley Centre is specifically to increase equity in research by including everybody, including those ethnic minorities which typically participate less in research, and also communities which may not have easy access because NIRS technology in particular is very portable.
The research project I proposed for this fellowship is called Personalised Medicine Treatment for Hypertension or High Blood Pressure, the Silent Killer. Black Africans are really disproportionately affected by hypertension. Their hypertension is associated with poorer outcomes and more target organ damage as well. But unfortunately, they're underrepresented in clinical trials, long-term kind of good quality randomized controlled trials. I want to look at that really fundamentally. What simple routine biomarkers can be used to develop this true personalisation?
Huge congratulations to everyone who's been successful in funding calls so far. We look forward to seeing the impact this work will have for our patients and communities.